Paige Hours, one of the Our Healthy Heart clinical health coaches at Atherotech Diagnostics Laboratory. I want to talk to you today about a health condition that has reached epidemic proportions in our country. A health condition that affects 29 million people just in the U.S. Diabetes. Diabetes is a disease in which the body is unable to properly use and store glucose, causing one's blood glucose, or blood sugar, to rise too high. Chronically elevated blood sugar increases the risk of developing heart disease, stroke, kidney and eye disease, and nerve damage. There are two main types of diabetes. Type 1 diabetes is where the body completely stops producing insulin, the hormone that enables the body to use glucose found in foods for energy. People with type 1 diabetes have to take insulin injections to survive. This form of diabetes usually develops in children or young adults, but can occur at any age. Type 2 diabetes is what we're going to focus on today. This is where the body doesn't produce enough insulin, or it's unable to properly use the insulin it does produce. This form of diabetes usually occurs in people who are over 40, overweight, and have a family history of diabetes, although today it is increasingly occurring in younger people. 80% of people with type 2 diabetes are overweight, so diet and lifestyle play a major role in improving diabetes control. Let's look at a few ways you can help control your blood sugar and reduce your risk of diabetic complications. First is weight loss. Weight loss is one of the most important goals in most people with type 2 diabetes, yet it can be difficult to accomplish and even more difficult to maintain. A good place to start is to reduce calories by 250 to 500 calories every day. This should result in a weight loss of 1 pound every 1 to 2 weeks. This may not sound like a lot, but it is healthy, sustainable weight loss. Secondly is physical exercise. An essential component of any healthy lifestyle, including good blood sugar control, is physical activity. Aim to achieve a target of 60 to 90 minutes of moderate intense physical activity most days of the week, equaling 150 to 175 minutes per week. Lastly is a healthy eating plan. There is no one-size-fits-all diet plan for those people aiming to lose weight and improve their blood sugar. However, there are general guidelines that will benefit anyone with the goal of managing diabetes. A good place to start is by controlling your carbohydrate intake. Carbohydrates are the only food group that raises blood sugar, yet our diets contain predominantly carbohydrates. Here you'll see some examples of carbohydrates: breads, cereals, pasta, grains, potato products, corn, peas, beans, fruits, and sugar-sweetened foods and beverages. Controlling your carbohydrates doesn't mean you have to eliminate all of these foods from your meal plan. Your body actually needs a certain amount of carbohydrates daily to function properly. The key to good carbohydrate control is to choose healthier carbohydrates and consume them in moderate amounts throughout the day. Within the carbohydrate category, some choices are better than others. A cookie and an apple are both carbohydrates, but which one is healthier? The healthier carbohydrates, like apples, are called complex carbohydrates, meaning they contain fiber and/or protein. Whole fruits, beans, legumes, whole grain bread, brown rice, and sweet potatoes fall into this category. Because these complex carbohydrates contain fiber or protein, they are a better option than simple or refined carbohydrates such as juices, desserts, and highly refined baked goods. But it's not just the type of carbohydrate that's important, it's also important to limit the amount of carbohydrates you consume at one time. A good rule of thumb is to keep all carbohydrates per meal to 1/4 of your plate. This sounds overly simplistic, but it is effective. Practicing proper portion control of carbohydrates will help you keep your blood sugar levels in check. While carbohydrates are the only food group that increases blood sugar, people with diabetes are also at increased risk for cardiovascular disease and need to consider the types of protein and fat they consume as well. Protein is important in maintaining blood sugar stability. However, high-fat animal proteins such as fatty cuts of meat, full-fat cheese, and high-fat dairy increase LDL or bad cholesterol levels, increasing the risk of plaque formation in the arteries. Instead of those, choose lean proteins such as poultry without the skin, fish, nuts, low-fat cheese, and meat that's trimmed of visible fat. Diabetics also need a good variety of brightly colored, non-starchy vegetables to provide disease-fighting fiber, vitamins, minerals, and phytonutrients. These include all types of greens, tomatoes, peppers, cucumbers, broccoli, and many others. To enjoy a balanced meal, choose 1/4 plate lean protein, 1/4 plate complex carbohydrates, and 1/2 plate colorful vegetables. This will provide you the nutrients you need while making certain you don't overdo any one nutrient group. An example meal using this plate method might consist of 1/4 plate of grilled salmon, 1/4 plate of wild rice, and 1/2 plate of salad. Colorful and healthy. Individuals with diabetes often also have high elevated triglycerides, VLDL, remnants, which are VLDL3 and IDL, and small, dense LDL. In excess, these lipoproteins will create a greater risk factor for heart disease. They are treated exactly the same way you treat diabetes, with a low-carb, low-sugar diet, weight loss if needed, and exercise. There is no fad diet, magic bullet, or quick fix that will help people with type 2 diabetes lose weight, control blood sugar, and reduce their risk for serious complications. There is just healthy and mindful eating coupled with an active physical lifestyle each and every day.